War is often remembered at the front, but another world existed behind the lines, one of wards, bandages, antiseptic, stretchers, operating tables, and long corridors that smelled of disinfectant and quiet grief. The First World War did not only create soldiers and battlefields, it created patients, doctors, nurses, orderlies, drivers, and medical systems forced to change faster than any had before. If trenches were the visible face of the war, hospitals were its unseen mirror, places where violence reappeared in different form, where bodies and minds arrived altered, and where survival was measured not in victories, but in breaths, heartbeats, and hours lived after surgery. This is the story of the War of Healing, a war fought without rifles, in rooms filled with suffering and fragile hope. Wounded soldiers entered the medical world in stages. Their journey began on the battlefield where stretcher-bearers worked under fire, lifting bodies from mud and shell holes, carrying them across uncertain ground, and placing them into ambulances or carts that lurched along roads cut by wheels and rain. The trip to the first aid station was already a test of endurance. A slow, jolting passage between pain and uncertainty. At casualty clearing stations, tents and wooden huts filled with men waiting for decisions. Who would be operated on first? Who could be saved? Who could be moved farther from the front? Who would never leave? Doctors read wounds as another language of war. Shrapnel, gas burns, fractures, infections, shock. Each wound told a story about the battlefield, even as it threatened to end the story of the man who carried it. The wounded learned that survival depended not on strength or courage, but on time. How quickly help reached them, how soon a surgeon's hands found their injuries, how well the body responded to trauma. War reduced identity to pulse, breathing, and blood loss. The line between life and death ran straight through hospital doors. Hospitals multiplied across landscapes that had never imagined such purpose. Schools converted into wards. Estates turned into convalescent homes. Churches filled with rows of beds. Inside them, medicine stood at the edge of transformation. Surgery expanded rapidly. Techniques advanced not through textbooks, but through necessity. Doctors confronted injuries no previous generation had seen on such scale: shattered bones, torn tissue, burns from explosive heat, gas-damaged lungs. Anesthesia was both salvation and risk. Instruments, were sterilized with care that grew stricter as infection revealed itself as an enemy as deadly as any bullet. Nurses became the quiet anchors of hospital life. They washed wounds, changed dressings, calmed fear, wrote letters for men whose hands could no longer hold pens, and walked endless corridors through day and night. They learned to read silence, to understand pain without words, to balance compassion with emotional survival. Their labor was disciplined, relentless, often invisible, and absolutely essential. Orderlies carried bodies, cleaned floors, moved equipment, pushed stretchers, disposed of bandages stained with memory. Ambulance drivers crossed cratered roads through darkness and rain, guided only by dim lamps and instinct, transporting life in fragile motion. Hospitals did not feel like refuge. They felt like another front. For patients, time inside hospital walls stretched and warped. Pain divided days into small intervals. Movement, dressing changes, fever spikes, restless sleep. Recovery was rarely a straight path. Wounds reopened, infections spread, bones refused to heal cleanly. Limbs were amputated to save lives, transforming survival into a different kind of loss. Prosthetics workshops emerged, fitting men with artificial arms and legs crafted from wood, leather, and metal. Each device carried both promise and grief, proof that a life would continue, but never as before. Mirrors became difficult companions. Identity shifted. Bodies no longer aligned with memory. Beyond physical wounds lay injuries the medical world struggled to name. Tremors, paralysis without visible cause, nightmares, uncontrollable fear, sudden silence, the symptoms of what would eventually be called shell shock. Doctors debated, classified, misunderstood, and slowly began to recognize that the mind could be shattered even when the body survived. Hospitals became spaces where the unseen part of war revealed itself. The medical front transformed the role of women. Nurses, volunteer aid workers, drivers, clerks, and organizers formed vast networks of care. Some came from professional training, others learned through experience, guided by resolve and necessity. Their work demanded strength, precision, emotional resilience, and sacrifice. They witnessed pain without turning away, confronted death repeatedly, and carried memories they rarely spoke aloud. The war expanded their responsibilities and permanently reshaped society's understanding of what women could do. Hospitals were more than treatment spaces. They were spaces of redefinition. Medical care formed its own map across the war. Field stations stood close to the front, surrounded by noise and dust. Casualty clearing stations marked the threshold between combat and withdrawal. Base hospitals lined coasts and cities far enough to allow recovery, close enough to receive steady waves of the wounded. Hospital ships crossed seas, their decks filled with beds and bandages, their hulls marked with symbols meant to protect them, symbols not always respected. The journey from field to hospital was not simply movement. It was transition between worlds, each one shaped by hope and limitation. The farther a patient traveled from the battlefield, the more survival seemed possible, but distance did not erase the past. When the armistice came, hospitals did not fall quiet. Wards remained full. Recovery continued. Thousands lived in prolonged convalescence, learning to navigate prosthetics, weakened lungs, chronic pain, and memories that resurfaced without warning. Some never fully left the hospital world. Others returned home transformed, carrying the invisible signature of medical spaces in the way they walked, breathed, or remembered. The war ended on paper, but healing did not. Hospitals became monuments without stone or inscription, places where the cost of war survived in living bodies. The medical war changed the world. Surgical techniques advanced. Infection control improved. Rehabilitation medicine expanded. Mental health began slowly to be recognized as part of human survival. The role of nurses gained new authority. Ambulance systems, hospital design, mass care logistics, all evolved because they had to. Yet the most enduring legacy was human. Behind every medical breakthrough was a body that felt pain, a nurse who did not sleep, a surgeon who made a choice in a moment that could not be repeated, a patient who carried scars into a lifetime. The First World War did not end at the hospital doors. It lived inside them, and the echoes still remain.